Okay, so we're here in Ghent in Belgium. We've just finished teaching together our 2-day hip course. We're getting excited now, coming out to Perth again in July with AAP education through Doug Carey. Those of you that weren't with us last year, we had a fantastic 2 days teaching. We did day 1 of our hip course and we did day 2 of our running course, and now we're coming back to do day 2 of our hip course and our knee course. Yeah, so Ben, do you want to explain a little bit about what we'll be covering?
Yeah, so it's really exciting to be back in Perth, where we had great audience, and so what we try to do is look at more the athletic hip and knee. So on the hip element, we're going to go mainly on the rehab element. So even if you're not attending the day 1, you'll still be able to get straight into the rehab. So we'll be looking into what's the current evidence-based rehab progression for FI syndrome, and also we'll be covering in extra-articular pathology, especially adductors, glute med, iliopsoas and proximal hamstring as well. So we try to look into the whole spectrum of both articular and extra-articular. So that will be the main focus on the hip course. The knee course is mainly we're going to look at the high demand knee. So somebody who is sort of between that 18 to 45 who wants to get back into recreational sports, pivoting, cutting. So the pathology we'll be covering is mainly looking into progression in ACL, which could be pretty much similar for any high demand knee. We'll also look into current update on rehab following meniscal repairs, meniscectomy, those sort of things, looking into some of the early OA. And also the most important is how to design a structured return to play, which I think can be a bit tricky because there's a lot of factors here, time factors, performance markers, strength deficits. So we'll go through all the sort of testing, and as a full-time clinician, we're looking into technology which you can imply in your clinic. So we won't be using any advanced stuff like force plates and things like that, but simple devices which you can use in your clinic to have a very strong case for return to performance. So as therapist, I'm just not interested in return to sport. For me, the rehab is only complete when it's return to performance. So it's the journey from the acute injury back to return to performance in the high demand knee.
So I think it's fair to say we're both really excited about returning, looking to see some familiar faces hopefully that came on our course last year. And as we said, if you didn't make our courses last year, it's not a prerequisite, so they are standalone days. So really excited about seeing you in Perth in July through AAP Education and Doug Carey.
See you guys.